All right, let us talk about venous return. Venous return is the flow of blood back to the heart. So we've mentioned this in passing, but there are a bunch of factors that are going to aid in this venous return. Venous blood pressure alone is far too low to promote adequate blood return. And so we need to aid it. And this aid is going to occur in a couple of different ways. There's going to be what's referred to as a respiratory pump. And basically, the respiratory pump is the change in pressure, internal pressure, due to breathing. We're going to talk about that in physiology, the exact mechanism. We'll touch on it here. In the respiratory system a little bit, but basically in order to pull air in and then push air out, we have to vary the pressure in our chest cavity. And so that variation in pressure in the chest cavity is going to have a ripple effect in the rest of the body, specifically the abdominal cavity. So this change in pressure is going to create a pressure gradient and help pull blood back towards the heart. The other one, and this is far more common in your limbs, legs specifically, is the muscular pump. Basically, your muscles contract around your veins, and as they contract and relax, they milk blood back up towards the heart. This is why if you are on a road trip or you're on a plane, especially if you have cardiovascular issues or you're getting older, they recommend, if you're on a road trip, stopping frequently, get out, walk around, and move about. Get your blood pumping, get those muscles contracting. Now, or if you're on a plane, it's like wearing compression socks, which help push blood up and out, tapping your toes, getting up and walking the aisle, that sort of thing. You want to keep those muscles contracting around your veins, pushing blood back up. To help with this, because there's always going to be a period in which there is no pressure or decrease in pressure. To help prevent that backflow, we have those valves. So if you have long periods of standing, or I should say sitting, long periods of standing or sitting, blood can pool because of gravity, and we want to push it back up towards the heart. So valves help prevent that. However, especially with age and excessive use, these valves can fail. And then you have lovely things like edema that forms. And a couple of other issues, but this is problematic. Artistic rendering of that skeletal pump.